It's a great pleasure to be able to speak to you this afternoon about the Heart Foundation's experience in working in the food service sector. I think we all agree that eating out is becoming a common everyday experience. For many people, it's no longer that special treat. It's the toast you buy with your coffee on your way to work, the sandwich you pick up at lunchtime, or the takeaway chicken you grab on the way home for dinner. Australians are now spending more than 42 cents in every food dollar eating out of the home. But the danger is, when eating out, we throw caution to the wind. Portion sizes are often larger, and many of the meals that we are served will contain more saturated fat and salt than the meals that you will prepare at home. Unfortunately, many of us do not consider the impact this may have on our overall diet or the long-term consequences on our health. In the next 18 to 20 minutes, I will outline how the Heart Foundation sought to address this issue through implementation of its tick in food service strategy, which went live in 2006 and remained in place till 2011. I will frame this presentation around 5 principal questions: the decision, the experience, our decision to exit, the learnings, and the legacy that our experience has provided. I will then conclude with several observations on current gaps and opportunities in the food service sector that warrant consideration for the future. Before I start, however, I think it's important to spend a minute revisiting the rationale that underpins the Heart Foundation TIC program for anyone who may be new to public health and nutrition. Heart Foundation TIC was launched in 1989 as a not-for-profit program, and its purpose was twofold. One, to drive reformulation of processed foods, particularly the levels of sodium, saturated fat, trans fat, and overall energy contained within food products. And secondly, to signpost a healthier packaged food choice within a food category such as breads or simmer sauces, without the need to read and interpret nutrition panels or ingredient lists. The TIC program set evidence-based nutrition standards across different food categories. Food companies would then apply to carry the TIC logo on their packaging if their food products have been independently tested and found to comply with the TIC criteria. TIC nutritional standards are reviewed every 3 to 5 years to make them incrementally tougher, and it's worth noting that participation in the TIC program is voluntary. TIC licence fees cover costs associated with random audits, marketing, criteria development, and general administration. A graduated fee structure makes it equitable for smaller companies to join the program, and costs start at approximately $6,000 for smaller companies. At present, there are about 2,000 retail products approved to use the TIC. So, to our first question, what influenced our decision to go there? Well, there were a number of factors, both direct and indirect, that influenced our decision to expand beyond the retail sector and consider food service as a new setting. By early 2002-2003, TIC was a mature program. We'd been working in retail sector for about 15 years, and industry requests to stretch the TIC brand was starting to occur. Catering and food companies were aware that consumers were starting to look for healthier options, so companies were increasingly keen to put TIC on a broader range of food products to indicate a healthier option. Added to this was evidence from the 1995 National Nutrition Survey that showed an association between frequent eating out and higher intakes of saturated fat, salt and sugar. Market trend research was also indicating that 1 in every 3 food dollars in Australia was being spent in an eating out environment. And there were estimates that between 3 to 4 million Australians were visiting fast food chains or independent outlets on a daily basis. Clearly, the food industry was playing an increasingly important role in shaping what Australians were eating. These trends were also fueling growing public concern about overweight and obesity, and events such as the New South Wales Childhood Obesity Summit highlighted the need for strategies that went beyond the rhetoric. The Heart Foundation New South Wales, as part of our national overweight and obesity plan, had also been piloting several food service programs such as Tips on Chips and Clubs with Hearts, with fish and chip outlets and RSL clubs across the state. This had provided some insight into the opportunities and challenges that existed in standardising meal deals within the food service sector. But it also framed the focus of what type of food service company we would need to work with to ensure consistency and scalability. Finally, because the Heart Foundation is an evidence-based organisation, we spent 2 years undertaking a feasibility study that involved development of an internal food standard for meal deals that would apply to all food service companies, covering serve size, level of saturated fat, trans fat, salt and vegetable fibre content. Secondly, an independent quality assured audit process that would enable random and timely testing of food samples from any site across Australia. Thirdly, training programs for food company staff to ensure standard consistency in point of sale information and food preparation. And fourthly, marketing guidelines to ensure correct use of the TIC trademark and compliance with current food regulations and codes of practice. We also undertook extensive market research to gauge public opinion on signposting healthier food options when eating out, and consulted with the food service industry to test the concept in detail. At this point, all was looking good. This culminated in a detailed 5-year business plan that outlined the strategy, scoped the various costs, detailed anticipated projections in growth, and estimated potential improvements to the food supply chain, which would be achieved by those directly and indirectly servicing the sector. Our experience in retail TIC reinforced the need to work with the food industry in developing an intervention. And as part of the feasibility phase, we worked closely with several large food catering companies and the standards company SIA Global to test different elements of our proposed model. It is worth noting here that it was never the Heart Foundation's intention that TIC should appear on all menu options of a participating company. Instead, building off what consumers already knew about the TIC in the supermarket environment, our goal was to signpost a healthier food choice compared to other or similar foods on the menu in that particular setting. Hence, on the 9th of August 2006, the Heart Foundation went live on its TIC food service program. Features of this program included a structured application and assessment, approval and monitoring process, backed by ongoing compliance and independent assessment. These measures were all designed to maintain integrity in the TIC program, and the rigour inherent in this model meant it was a world first. Oh God. So what happened next? Well, initially we launched with Qantas and Sodexo, a food catering company that services large workplaces. Over the next 5 years, Crust Gourmet Pizza, Spotless, Delaware North and Jester Pies would also join the program. However, it was the announcement that McDonald's was joining the program in February 2007 that excited the most interest and became an ongoing touchstone for the media for the rest of this time. What is often underappreciated in any discussion about Heart Foundation's TIC food service program is the amount of work any interested company had to undertake to even qualify for consideration. In the example of McDonald's, it took 3 years for them to reformulate their food products and food preparation methods to comply with the requirements of the TIC and to put in place the staff training and the specifications to their suppliers to make the changes workable for their business model. Most people assume that their changes were only confined to their TIC-approved meals, but in fact there was wholesale change in the salt and energy compositions of their breads and buns, a change in the compositions of oils used in food preparation, a reduction in the salt content of their sauces, and a change in the methods of their food preparation, such as not salting their fillet of fish. Okay. In addition, they knew that once they became a TIC licensee, in any 1 week, 2 of their then 774 stores would be mystery shopped to assess staff knowledge at point of sale and to take samples of TIC-approved meals that would then be independently assessed for compliance. It was a serious undertaking for any company, including McDonald's, and one that potentially had risks if their business was found not to be compliant. So, now let's fast forward 5 years, because time is of the essence, to the announcement that the Heart Foundation was exiting the food service program. Why was this decision taken and what influenced it? A key factor was the review of our 5-year business plan that demonstrated the program had not gained traction in the marketplace in the way we had expected. We still only had 5 active licensees, and thus the food service program was not delivering a competitive edge in the same way it had and continued to do so in the retail sector. This failure did not stem from implementation and operational processes embedded in the model, but more the inability to attract a sufficient number of paying licensees. This was a significant impediment, as our compliance measures meant it was a costly program to implement, and without anticipated growth, it was hard to sustain the program in the face of other public health investments that the Heart Foundation could make. A second consideration was that we did not have the marketing budgets to counter many of the myths and misconceptions that were attributed to the program. Time and again, TIC was criticised as a money-making exercise for the Heart Foundation rather than a quality improvement program that utilised its funds to ensure strict adherence to compliance measures. A third factor was the changing food environment. A lot had happened since the food service launch in 2006. There had been the federal government's 2007 roundtable collaboration on trans fats in the quick service restaurant industry to address how trans fats could be lowered in the Australian food supply. There was the establishment of the federal government's Food and Health Dialogue in 2009 to drive voluntary reformulation across a range of commonly consumed foods. There was implementation of social marketing campaigns like Swap It, Don't Stop It and How Do You Measure Up that were providing everyday strategies on how Australians could achieve a more healthy weight. Certainly several large quick service restaurants had also voluntarily switched to the use of healthier oils in food preparation, and the Blewett report on labelling logic was released in January 2011. So it was a very dynamic time. Overseas, we were also seeing new initiatives such as calorie labelling in fast food outlets in New York and intervention trials in the UK. Collectively, these changes suggested there may be a better way to drive reformulation in the sector, and one option might be through upstream regulatory measures rather than reliance on voluntary ones. So with hindsight, what were the key learnings from our endeavour? Firstly, I think it's fair to say that the TIC move into the food sector or food service sector was a complicated proposition that perhaps we never clearly articulated enough with the community nor the public health sector. Internally, we saw it as an extension of our TIC strategy to signpost healthier options in an environment where a significant number of Australians were eating every day. But others took a more narrow view, seeing it as the Heart Foundation giving licence to eat fast food. Secondly, we perhaps underestimated how sophisticated and complex the food service sector actually is. The point of entry for meal deals is much higher and more difficult to navigate than for products within the retail sector, and perhaps we as an organisation should have reflected on this difference more. Thirdly, as is the experience with most public policy, evidence is never enough. Our journey into the food service sector was informed by feasibility studies, market research, consultation with the quick service restaurant sector and other factors. But the capacity to build momentum and overcome some of the more emotional assumptions about the program required more. We certainly acknowledge that independent evaluation of the program to Chapter, its impact on all participating parties would have been beneficial, and we would recommend this as an essential requirement for any future programs to enable full objectivity. Finally, we were surprised to find tolerance for our intervention amongst some public commentators was so low. To be innovative in public health nutrition is enormously challenging, so we need to be mindful that quick judgment can potentially stifle curiosity and insight and result in more risk-adverse approaches. Nonetheless, there were significant legacies associated with our experience and ones that have positive ramifications until today. Firstly, the Heart Foundation is proud of its leadership efforts to drive change through this sector. We created a paradigm shift in how the quick service restaurant industry could be engaged in food reformulation and demonstrated how it could be done on a national scale. Secondly, it provided us with the knowledge and insight into the food service sector and the levers to drive reformulation. For instance, the buying power of McDonald's led to improvements in the nutritional profile of food products sourced from different suppliers across the country and drove interest in TIC from various parts of the food industry. Our intervention also helped forge a new dialogue and way of engaging with the quick service restaurant industry, which was instrumental in paving the way for New South Wales Government to introduce mandatory kilojoule labelling in 2010. The Heart Foundation played an integral negotiating role between the various players because of our understanding of the sector, and this benefit eventually extended across the country to include those jurisdictions that currently do not have supportive legislation in place. Our focus on the changing trends of food being eaten out of the home also contributed to a national discussion about this issue, particularly with regard to ready-to-eat meals and the increasing trend to meal assemble rather than cook from first principles. Finally, and somewhat ironically, we've developed a model that our international colleagues at the American Heart Association have recently chosen to follow by launching a display of their health check mark on 20 Subway meal deals, with more to come. So, in conclusion, I'd just like to touch on 3 gaps and opportunities for the future. With regard to gaps, we need to supercharge public education on kilojoules, and I think that's been talked about at length today. Current evaluation shows there's still a need for greater understanding of what kilojoules are and how labelling in supermarkets, cafes and quick service restaurants can help make healthier choices when purchasing snacks or meals. Secondly, we do need to develop strategies to address reducing salt and saturated fat in the quick service restaurant sector as part of New South Wales' current legislation. This is an important driver to continue food reformulation in this environment, and we need to think creatively, as others have said, about how we can do this given that the menu board is a crowded space. We also need to increase greater investment in the food and health dialogue, and I think if anything else we should all be leaving today writing letters to our local members to rah-rah the food and health dialogue as a great opportunity to really drive action in this area. The UK has shown a way forward on how we can do this. We need to learn from their experience. In terms of opportunities, I think there is a pressing need to reduce public confusion between calories and kilojoules. And I think one way to work with this is with the media and popular TV programs like The Biggest Loser, and social media for that matter too, because I think we need to model how we can use kilojoule labelling and other tools and strategies in our everyday lives. I think that we talk a lot about it. We need to go to the place of modelling how to use these tools. We also need to engage more directly with the food service industry to drive this agenda. Our experience demonstrated that there can be productive ways found to work forward. We may not always be in agreement, but there is common ground. Finally, I think we need to start to broaden our focus and consider strategies that influence the workforce, be it chefs, cooks or hospitality staff, and ways that we can engage them in this issue. In conclusion, I'd just like to acknowledge the companies, organisations and people that were instrumental in assisting the Heart Foundation develop and test the feasibility models that allowed us to scale our food service strategy to a national offering in August 2006. Their names are here and they really did go beyond the call of duty in delivering this initiative. Thank you.